Okay, let's get started. Hello everyone. My name is Ashwant and I'm one of your TAs for the course Drug Delivery Principles and Engineering, and this is week 7's problem solving session where we look at previous year's week 7 questions as well as some this year's week 5 assignment solutions as well. Okay, with that let's get started. Can someone confirm if they can see my screen?
Yes, sir.
Okay, great. Okay, let's look at the previous year's week 7 questions first. Okay, so the first question is rank the following injection routes in order of the shallowest to the deepest needle penetration. So they want you to rank it in the order from which it's of less depth to the deepest penetration that's happening. Intramuscular, intradermal, subcutaneous, intramuscular, subcutaneous, intradermal, subcutaneous intradermal muscular, subcutaneous muscular intradermal, intradermal subcutaneous muscular, intradermal muscular subcutaneous, intradermal and subcutaneous only. Muscular is not convenient and is hence not for muscular and subcutaneous only. Intradermal is hardly ever administered in humans. Sorry, someone was saying. Yeah, so which of the following orders do you think is the correct one?
Is this C? Answer C.
Okay, so subcutaneous, intradermal, muscular. Okay. Any other thoughts? Okay, so you are correct in thinking that muscular is the most penetrating in terms of needle injections. But actually, intradermal is much comes much more sooner than subcutaneous. So option E is the correct option. So if you look at the penetration of the needle, so intradermal injections do not go that deep. They're just under the epidermal. They're within the epidermis layer and right below the first couple of layers of your skin. Followed by intravenous and then subcutaneous, which is within the subcutaneous tissue, which is below the dermis of your skin, and which is followed by the muscle, obviously, which is the deepest form of penetration that an injection can undergo. Okay, any questions? Okay. So, what are the advantages of drug administration through oral route? Two options are correct here. Unconscious patient can take the dose
E.
by
Patient compliance.
patient compliant. Okay. What do you think could be the other option? So,
Non-invasive, sir.
non-invasive. Okay. Yeah. So both of the
Option
options.
A.
Yeah, both of the options are correct. Oral route is very patient compliant and it's also very non-invasive. So tablets are not invasive, right? Yeah, that's the idea. Okay. So which of the following route is susceptible to first pass effect? Is it the sublingual route, oral route, transdermal, rectal suppository? Okay. Yeah.
Oral, oral.
Correct. Oral route is where the first pass effect and elimination of most of your drug by the liver happens, right? So yeah. Consider that you want to deliver drugs to the eye. Which of the following methods would work best?
Excuse me, sir.
Yeah.
Sir, can you
Yeah.
go back to the previous question, please?
Yeah.
Acha, susceptible. Okay, I got it.
Okay.
Hello,
Yeah.
hello.
Yeah. I can hear you. Can you guys hear me?
Yes. Okay,
Intraocular.
go on, sir. Okay.
Yeah. Okay.
Sir, intraarticular, sir.
Okay.
Intraocular.
Okay.
Intraocular sir, D option.
Sir, ocular, sorry, sir.
Okay. Yeah. So intraocular route of delivery is what you directly deposit in the eye, right? So that's the correct option. Okay. So which of the following are disadvantages of subcutaneous modes of delivery? Two options are correct here.
Sir,
Patient self
option A and B.
option.
So option A and B.
Okay, so you're saying patient self-administration is not is a disadvantage. Okay,
C and D, sir.
okay. So small volumes of injection and causes irritation to the site of injection is what you think are the disadvantages. Okay. Any other thoughts?
Small volume of injection
For
and
D
causes
and E.
irritation to the site of injection.
Okay. Yeah. Yeah. Option D. Okay. Yeah, so patient self-administration is usually considered an advantage because the patient need not then travel to the hospital or clinic and spend time as well as money to get there, and then it takes up the time of the healthcare professionals as well, right? So patient self-administration is usually considered an advantage, but not in this case because they're asking for disadvantages here. So small volumes of injection and causes irritation to the site of injection are what the disadvantages of the subcutaneous mode are. So you cannot inject too much volume into the subcutaneous tissue, and there's also this irritation that comes up if depending on the patient. There's patient to patient variability, of course, but yeah. Okay. So which of the following statements are disadvantages of intramuscular mode of delivery? Patient can administer the drug themselves. Large volume of injection can be given compared to that of
D and E,
subcutaneous.
sir.
Okay, so you're saying
Sir,
it's
option B was one option.
option.
D and E.
You're saying B. So
Yes, one
D,
option.
D and E.
okay,
Option D and E.
okay. So
Invasive and irritation at the site of action.
okay.
Site of injection.
Correct. Yeah. Intramuscular mode of delivery is invasive, and there's inflammation at the site of injection. If you guys have taken tetanus shots, there is some inflammation and irritation that happens for 24 hours to 48 hours, right? So those are the main disadvantages. So coming back to option B, so if you can inject large volume of injection, then that would be great, right? So it's usually not considered a disadvantage. You can inject large volumes in intramuscular mode of delivery, but it's an advantage for intramuscular mode of delivery. Okay. Which of these methods cannot be used for enhancement of permeation through the skin? Can chemical enhancers not be used, or iontophoresis, or electroporation, ultrasound, physical rubbing, or photography?
Physical rubbing.
Okay. Any other thoughts?
Ultrasound.
Okay.
The photochemical energy.
Sir,
Okay.
ultrasound.
Okay. Yeah, so you generally ultrasound and photochemical energy are routinely used in at least in academic setting to sort of enhance the permeation through the skin. So those two are not correct. So ultras
Physical rubbing.
yeah, so physical rubbing is what you should not do to sort of enhance this skin permeation because it really doesn't make sense. It doesn't help, right? So, anyways, your skin tissue is tightly packed, and if you're physically rubbing, then it might sort of so if you're injecting nanoparticles or something, it might disturb the particles or break the cells that are in the vicinity or cause inflammatory reactions and so on. So physical rubbing is not something you would want to do to increase the permeation. Okay. Which of the following statements about excipients is not true? Okay. So PEG is a binder used to impart cohesiveness to powder. Silicon dioxide is a glidant used to facilitate breakup of the drug formulation. Sucrose is a diluent used as bulking agent for low dose delivery. Talc is a lubricant used to improve powder flow and reduce adhesion to compression die. Starch is a disintegrant used to improve drug formulation taste. Coloring agents and flavoring agents are also excipients. So excipients are something that are added along with vaccine to or medicine to.
PNC.
Option C, sir.
Option C. Okay.
PNC.
So silicon dioxide is not a glidant. You're saying. Okay. Any other thoughts?
E can be there. So E starch formulation test.
Okay. Yeah. Yeah. So let's go to E first. So starch is not very tasty, right? So I mean, it doesn't make any sense to add it to improve drug formulation taste. So option E is not a correct option, and also B. So silicon dioxide is not a glycine, so it's not really used to facilitate the breakup of drug formulation. So sucrose is a diluent. So a lot of medicines tablets use sucrose as a bulking agent. So option C is what pharmacies routinely use. Okay. Enteric coating is a coating of polymer containing which of the following groups? So, is it a hydroxyl group? Is it a nitric group? Is it a PEG group? Carboxyl group? Amide linkages or thiol groups?
Carboxyl groups.
Okay, yeah. So, enteric coating uh, makes the polymer sort of have this carboxyl group. So, yeah,
Sir, in the previous question,
yeah.
previous one here.
This
No, no,
one,
sir. No, yes, this one.
huh?
Sir, starch is a disingredient. Sucrose is a diluent used as a bulking agent. Low dose delivery, sir. Can you elaborate on this? Because sucrose, we mainly use lactose and DCP.
Yeah.
Sucrose,
Lactose is what people use academically, but sucrose is also lactose and sucrose more or less they use interchangeably in pharmacies, so it's not a major concern. Any lightweight, similar molecular mass sugars can be used. So yeah,
okay, sir. Thank you.
yeah, okay. Okay, so a 5 mg per ml dose of drug, they've given the molecular weight 890 daltons, needs to be delivered to a comatose patient. The drug is susceptible to first pass metabolism and has a high partition coefficient in both water and oil. Identify the least invasive route of administration, assuming equivalent biodistribution through all routes. Okay. Uh,
Transdermal,
Inhalation.
okay.
intranasal, and transdermal can both can be given.
Okay.
Less than less than 1,000 Dalton.
Yeah. Inhalation, intranasal, transdermal, all three can be given. They are least invasive routes of delivery, but they haven't really specified where the drug needs to go, right? So they haven't specified whether the drug needs to go to the brain or the respiratory system. So usually you
Transdermal.
you would not want to include intranasal or inhalation. So the remaining option is transdermal route of delivery. Um,
Will it, sir? Will it that be that through international this intranasal this 5 mg per ml cannot be accurately given?
can we?
Cannot be accurately given. Can 5 mg per ml accurately be given through international route?
Yeah, you can. So the patient will still be breathing, right? So there are intranasal formulations where you can accurately. So I don't know if you've ever faced this problem of bronchitis or asthma, but they have this metered doses. So they release specific amount of. Uh,
Salbutamol pumps.
Sorry.
Salbutamol.
Yeah, so they release specific amount of drug. So they are metered releases. So you can give very specific doses. Not an issue. Okay. How much of the drug actually reaches gets absorbed within by the mucosal layers and reaches the target is another question. So that you would sort of optimize during your formulation, right? So that should not be a problem. Okay. Which of the following methods is not used to enhance permeability for transdermal delivery? Select all possible answers. So there might be multiple answers that uh, might be correct. So use of surfactants to destabilize the lipid motor layer packing, conversion of drug to a lipophilic drug, iontophoresis, reducing the partition coefficient of drug in oil phase, ultrasound, bombardment using gene gun, use of bioadhesives, microneedle system.
E and G.
E
D and G.
D and G. Okay, conversion of a
D,
drug
D
to.
for dog. Reduce in the
Oh,
partition coefficient and use of biodiesel.
okay, okay, got it. Any other thoughts? Yeah, you're absolutely correct. So reducing the partition coefficient of the drug in oil phase is counterproductive to what you're trying to achieve here. So the permeability would actually go down. So that's not correct option. And bioadhesives are something that are commonly used for a different route of delivery, right? So oral route. So okay. Which of the following is not an advantage of gastrointestinal tract delivery using gastric balloons?
So option A.
Okay, so you think ease of administration is not an advantage. Okay, so let's go through the options. Option A is ease of administration. Option B is gram level dosing. Option C is good immune tolerance. Option D is non-invasive. Option E is ability to deliver low soluble drugs.
Gram level dosing.
Okay. Yeah. So let's go through the options. So ease of administration, if ease of administration is existent in this gastric balance, it would not be a disadvantage, right? If anything, it would be an advantage. So most probably not. Gram level dosing. So if you go back to your lectures, uh, we discussed this gram level dosing that's possible only through mostly through this route, right? So you can deliver high amounts of drug through this route. So that's not again that's not a disadvantage. Good immune tolerance, we really don't know. If anything, if it exists, it's not a disadvantage. Non-invasiveness, not really non-invasive because if you remember, so these gastric balloons they need to be surgically removed after generally usually 6 months, but again depends on drug to drug, but they need to be surgically removed from the patient's stomach. So it's not non-invasive. So that would be so it's not an advantage of gastric balloons, right? So because it's invasive and ability to deliver low soluble drugs, yeah, you should not, that should not be a problem. So option D is the correct option. Okay. Any other questions before we move on to this year's week 5 assignments? Okay. Okay. So we'll briefly look at the week 5 assignment questions and see if you guys have any doubts. Why do proteins adsorb on material surfaces? Is it because they're weak surfactants? Is it because they tend to increase their activity after interaction with biomaterial
So option
surfaces?
B.
Okay. Okay. Any other thoughts?
Option A.
Option A. Okay. Yeah. So it's not option B. So there is really no evidence that says that proteins tend to increase their activity after interaction with biomaterial surfaces, right? So if anything, they'll have reduced activity. So for instance, if you take one specific protein, I don't know, let's say DNase. So it will degrade DNA, right? So its activity is going to be reduced once it interacts to the biomaterial surface because it's no longer willing to. It undergoes conformational changes and it's no longer willing to interact with the DNA. So if anything, its activity would go down. So why else would they absorb? Because they are weak surfactants. So they have both hydrophilic and hydrophobic regions. So which sort of enable, especially hydrophobic regions, which sort of enables them to sort of then interact with these biomaterial surfaces. Okay. Which of the following two statements are false about protein adsorption in biomaterials? Limited adsorption sites and consequent competition means that not all proteins in the plasma phase can be represented on the surface. The driving forces for adsorption are the intrinsic surface activity and bulk phase concentration of the proteins. Once a protein gets absorbed, it doesn't come off. Surfaces vary in selectivity of adsorption. Adsorption is highly dynamic. Proteins always lose their structure and function after adsorption, or the biological activity of the adsorbed protein varies.
So C and D, if I guess.
Okay. C and F. Okay. Yeah. So once a protein gets absorbed, it doesn't come
E
out.
and F.
Yeah, really doesn't make sense because there's this phenomenon that goes on where initially there's this protein absorption and eventually it's replaced by other proteins that are more thermodynamically favored, right? So that's that. And yeah, so okay. Sure. Anyways, let me move this. Yeah, Shahbaz Ali, I've muted. So I've muted you because your mic is on. So if you have any questions, just type them in the chat and we'll look towards it. Okay. So yeah, so C and F are the correct options. Proteins need not necessarily always lose their structure and function after absorption, and once a protein gets absorbed, it does come off and get replaced by more thermodynamically favored proteins. Okay. Consider that cells are resuspended in a rich protein solution, say fetal
Sir,
bovine
option
serum.
A.
Okay. So basically, they're asking us to rank the interaction of the different components, cells, waters, and proteins in respect to how short to how long they take to interact with this biomaterial surface. So, uh, you think water would interact first, followed by cells, and then
It's
proteins.
protein water.
Okay.
See,
So water, protein, and then cells. Okay.
water, protein, and cells.
Okay. Yeah. So since water is very abundantly present, it will interact first, and there are extracellular cells are very bulky in nature, right? So they'll take time to sort of migrate from their place to the biomaterial in question. And even if they're in close proximity, there are extracellular proteins that are present outside, right in the vicinity of the cell, or there are even transmembrane proteins. So they get to interact first, followed by the cells themselves. Okay. What are the common techniques to quantify protein absorption on material surfaces? Is it Western blotting, Northern blotting, Southern blotting, RT-PCR, QRT-PCR, atomic force microscopy, Eastern blotting, surface plasma resonance? So of
First
this,
one and last one.
For Western blotting and surface plasmon
Sir,
First one and
resonance.
Western
last
blotting
one.
and
Western
surface
blotting and
platform.
surface
First and
plasma.
last.
okay, everyone agrees. Yeah, yeah. So Western blotting and surface plasma resonance are two most common techniques to quantify protein absorption. Okay. Okay, so we were just discussing this. So what is Roman effect?
Sir, option B.
Option B. So you think replacement of kinetically favored proteins by thermodynamically favored proteins from a surface over time. Okay. Anyone has any other thoughts? Yeah. So option B is the correct option, wherein first kinetically favored proteins come very fast and interact with the biomaterial, but eventually they get replaced by more thermodynamically favored proteins. Okay.
Sir, one question is there.
Yeah. Okay. When nanoparticles are injected in vivo,
Sir, option C.
Okay. So the protein form a layer on the surface of the particles. Okay. So protein.
Slide is not visible, sir. I am still seeing the old slide, Western blotting one.
Everyone is seeing the whole slide.
No, sir.
No, sir. No,
Okay.
no, no.
Maybe connection issues. So you might want to refresh or rejoin if it doesn't change. Okay. So basically, they're asking when nanoparticles are injected, there's this protein layer that forms on the surface of the particle. What is this layer called? Protein corona. Okay. Any other guesses? Yeah, so it is protein corona, nucleophilic substitution, nucleophilic addition, electrophilic substitution, all this does not make sense in terms of adsorption, right? So they are, well, synthesis and chemical reactions for molecule between molecules, so it does not really make sense. Okay. If cells are transplanted from a human donor to a human
Option
accept,
B, autogenic.
okay. Okay, so if cells are transplanted from a human donor to a human acceptor, what kind of transplant is it? Okay, so the options are allogenic, autogenic, xenogenic, and antigenic. Okay, so you're saying autogenic. Any other guesses?
Option A.
Allogenic.
Okay. Yeah, so autogenic is usually when transplant happens within the same person, right? Something like hair transplantation, where they take your own hair and transfer it to the top of your head. That's autogenic. But if it's between individual to individual within the same species, it's allogenic. If it's individual to individual between different species, it's xenogenic. Antigenic is something that triggers immune response. So it's allogenic, not autogenic. Autogenic is within the same individual. Okay. For transplantation in humans, allografting is one of the most common approach.
Option A and B.
Yeah, option A and B. So I think we've discussed this
A
question
and B.
previously as well. Lack of donors and spread of diseases are the two major drawbacks. The third one being immune responses that come up. Okay. Which surface is more favorable for protein adsorption and why? Pick two. Is it a hydrophilic surface because it's more
Second and fourth.
charged?
Second and
Okay.
fourth.
Option
Hydrophobic,
B and D.
hydrophobic and rough.
Okay. So you guys think it's hydrophobic surface because it's energetically more favored to displace water and rough surface because of an increased surface area. Yeah. Both of them are correct. Okay. Yeah, so there is this problem that we've discussed last class, I believe. But if anyone wants me to re-explain the problem, I can do that. So basically, they've given you this Langmuir adsorption isotherm formula where theta is equal to Kp by 1 plus Kp. And the value of K they've given, the value of P as well they've given. So you know what theta is. So if you substitute these values, 2 into 2 by 1 plus 2 into 2, you get 4 by 5 or 0.8. Now they're saying there are a total of 10 to the power 5 binding sites, and they're asking you to sort of find out how many will be occupied at steady state. So the way you do this is go back here and see what the definition of theta is. So theta is the ratio of sites occupied by the molecule and the total sites available for adsorption. So theta is nothing but the uh, sites that are occupied at a steady state divided by the total number of available sites. So they've given total number of available sites. You can find out theta from this equation. All you have to find out is the total number of sites that are actually occupied. So 0.8 into 10 to the power 5 or 8 into 10 to the power 4 because they're asking you to write the answer as a multiple of 10 power 4. Any doubts? Okay.
No, sir.
Yeah, that's all I had. So if you guys have any questions, you can ask now. So I guess in the previous class, someone was asking about not getting half marks for options that are where you have two options and you've selected one correct option. So I've spoken to Rachit and other TS as well. So the consensus is this grading is taken care by Guru Raj. So you need to contact Guru Raj or the NPTEL office to figure this out. We are not able to do anything with this grading.
How can you contact him?
Let me see. Okay, I can. Let me see. I can share the email ID, but I'm trying to see if there's any other way to contact me. Did you guys raise a forum question with this?
No, sir, I have not.
Okay,
Should
so
I?
yeah, you can raise a forum question. So then one of us can direct it to Guru Raj and he can look into it. Yeah,
Okay, sir.
yeah. Okay. Any other questions?
Sir, week six, last questions.
Week six, last question.
Yes, sir.
So the deadline has passed, is it?
Yes, sir.
Okay. Let me find the question. Okay. Week six. Consider that insulin releasing cells are embedded in scaf. Consider that insulin releasing cells are embedded in a scaffold made of collagen. The rate of release from the scaffold is given by the equation R2 is equal to 2.2 millimoles per second. The dimension of the scaffold. Okay. Yeah. So fairly straightforward question. Let me copy this and paste it. Let me share my screen. Okay, you guys can see the screen.
Yes, sir.
Okay, great. Yeah. So I'll read the question first. So consider that insulin releasing cells are embedded in scaffold made of collagen. Okay. The rate of release from the scaffold is given by the equation R2 is equal to 2.2 millimolar per second. Okay, let's note this down. They've given this rate, something they're calling R2, as 2.2 millimoles per second. The dimensions of the scaffold are as follows. Area is 25 millimeter squared, width is 2 millimeter. And what they're asking is in steady state, how much insulin will be released in 5 seconds. Okay, so at steady state, they're asking in 5 seconds how much insulin will be released. Fairly straightforward because they have actually given you the release rate, right? So we know per second, for 1 second, 2.2 millimolar insulin is being released. So all you have to find out is for 5 seconds how much is released. So for this, all you have to do is 2.2 into 5, which is 11, right? No? Yeah.
Sir, is the release date is given? Here the
Yeah.
release date is given, but what effect this surface area then will have this diameters? Only multiplication of time into release rate will
Yes,
be
sir. I mean,
given to us.
Yeah.
area for what purpose it's used, and we also, sir.
Yeah, they have sort of given it to, I guess, throw you guys off. You don't need the dimensions of the scaffold because you're directly given the release. So if you're not given this release rate and instead they give you a formula by which release is happening, then you'll have to calculate the release rate by using this area and width. But in this case, they've directly given you the release rate. Yeah, these are just, this is just useless information. Just to confuse, I guess. But You don't need it. Does it make sense?
Yes, sir.
Yeah, so if they're not given this, they would have given something like the release rate will be given by the equation, let's just say some quantity x divided by area times width or something they will give. Then you'll have to use these values, so 25 and 2, and then x also they would give, so the diffusion coefficient. So then you would have to calculate the release rate and then multiply it by 5. But in this case, they've given the release rate as 2.2 millimolar per second, so you don't need it. Okay. Any other doubts?
Question number 2 of week 6.
Question number 2 of week 6. Why are stents used in blood vessels for tissue engineering? Okay, let me copy this question. Okay, so this is the question, right? Why are stents used in blood vessels for tissue engineering? Okay,
Yes,
so
sir.
yeah, so stents are something that are implanted in people with obstructed heart conditions, right? So if the heart valves are blocked, usually what the surgeons would recommend is you go for this operation where they put stents in. And the idea is that once you okay, let me see if I can show you the diagram of a stent to make more sense. Okay, so stent is something like this. So it's a mesh. So what they do is, so if you see, there's this pipe, there's this tube that leads into your blood vessel, and if you can see here, there's this black color balloon sort of thing that's blowing up. So this mesh is usually very small, so it's attached right to the tube, and there's this balloon that's not inflated. But once it's in the right blood vessel, what they do is they fill the balloon with air or whatever, and the balloon inflates. So this will sort of expand the mesh, and the whole idea is that okay, this is better. Okay, so as this balloon inflates, the mesh increases, and this mesh cannot sort of contract. So it will stay in place, and that will expand the blood vessel. And this blockage, whatever blockage is there, so that will sort of constricting the flow of the blood. It will sort of be alleviated because the blood vessel is now expanded. So that's the reason why people use stents. So to heal blood vessels is not a correct option. We are not healing anything there. To prevent hemorrhage, no. So stents cannot prevent blood leakage inside the leakage of the blood vessels, right? So that's not a correct option. So to open occlusions from vessels, so if there's complete occlusion, you can't do anything. So probably no. To Oh, sorry. So to open occlusions from blood vessels, so this could be a correct option. So let's mark it possible correct option. To bypass a blocked artery or vein. We are not bypassing anything here. So bypassing is having an alternate route for the blood to flow through. So we're not bypassing anything here. So might not be a correct option. To help
Can you
grow.
explain the bypass one? That was my problem actually. I thought it may be bypass the blocked artery or vein.
Okay, so if you go back to the diagram, so we are not really, so bypassing would mean, so if you have this block and if you want to bypass it, you will have a separate path for the blood to travel through, right? So let me draw this. Okay, so this is the blood vessel. It's clogged for some reason. So if you want to bypass it, you'll do this and you'll seal this off so that the blood can flow like this. So this is not something that stents do. What stents do
Okay,
is,
sir.
yeah,
Okay.
yeah. Any other questions? Yeah, so to complete this, we are not bypassing, we are not helping a new blood vessel to grow, we are not preventing senescence, or we are definitely not looking to cause further damage to excessive blood vessels. So let's look at the final option to increase the diameter of the blocked vessel, hence increasing fluid flow. Yeah, so option C and option H are the correct options. Okay, if you guys have no other questions, we can sort of end the session here today. Let me just see if there are any questions in the chat box. Explain assignment 6, last question. Okay, we have done that. So I guess no other questions. So thank you guys for joining. Uh, have a great week ahead. See you guys next week.
Thank you, sir.
Thank you, sir.